Great. Well, it's lovely to see you all back, charged with further mega calories in the form of banana bread. I'm going to recommend this hotel for its cakes. But you are all, of course, very welcome again. So second half of the ceremony, as I mentioned earlier, will be where we announce our commended entries to the inaugural Impact Prize competition and, of course, present a trophy to the winners. So this is a brand new prize that the MRC have introduced, our Impact Prize. Our intention is to run this competition annually, and it is to reward individuals and teams of researchers who make outstanding impacts in medical research and to advance areas such as open science, team science, and the support of early career researchers who have been pioneers in supporting wide research environment and culture. And of course, we've heard references to those in the two talks earlier. The development of this prize was a fairly long piece of work that was overseen by the MRC Prize Committee. And after significant discussion, it was decided that the Impact Prize should be awarded in 3 categories. The first one being the open science impact. So this is open to individuals and to teams at any stage in their careers, and it's awarded for an outstanding contribution to advancing science in medical research through open science. The second category is the outstanding team impact. Indeed, we heard earlier of the value of teams, the value of multidisciplinarity, and this is a prize to celebrate an inspiring and successful team of individuals whose collaborative approach and team science has made an outstanding impact on medical research. The final category is the early career impact. And this is a prize to explicitly recognise early career researchers who've pioneered new approaches to enable and support research and research community, and by example, advancing the wider research environment and fostering an excellent research culture. The inaugural competition, this year's competition, was open for nominations between April and July of last year for individuals and teams who had previously received funding from MRC or from the MRF, which of course is our linked medical research charity. The approach this afternoon is I have 3 very senior and esteemed colleagues who will lead on the description and the presentation of each prize, and I will introduce them in turn. For each category, we will hear from each of the finalists, showcasing their impacts, and we will present the highly commended entries and winners with a certificate and a physical award, respectively. So the winners will receive that trophy and £20,000 to advance or widen the impact of their work or to further learning. And of course, the way in which it's spent will be at the discretion of those who won the award. So to kick this process off, it is a huge pleasure and an honour to introduce an individual who is actually an old colleague going back to my Edinburgh days, Professor Malcolm MacLeod, who's Professor in Neurology and Translational Neuroscience at the Centre for Brain Sciences in Edinburgh and Academic Lead for Research Improvement and Research Integrity at Edinburgh University. And he's a key expert in advancing open science and is one of the leaders of the UK Reproducibility Network. So, Malcolm, would you come and join me? And I'll ask you then to kick off the process for the Impact Prize. And I shall retire to the audience temporarily.
Well, thank you very much, John. It's a great pleasure to be here. In addition to my attributes of being a professor of neurology and our academic lead for research improvement, I've also followed Professor Tabrizi's advice in that I always try and be the dumbest person in the room, which I think I'm achieving today. It's lovely to be here with so many people who've made such a great contribution, and I'm delighted to be presenting this first MRC Open Science Impact Prize, the winners and those that are highly commended. I was one of the expert reviewers in the nomination process and was delighted to see such a high quality of nominations. Open science is an interesting idea, isn't it? Because we all worry about publication, and so we would never do closed science, but it seems there's a bit of a gap between what we would consider to be normal publication pathways and what we mean by the full exposition of open science. And I think open science is critically important for a couple of reasons. We heard from Sarah about the development of new therapeutics for Huntington's disease. Let me give you another example of treatments for amyotrophic lateral sclerosis motor neuron disease, where we're involved in some clinical trials in Edinburgh. Imagine that the breakthrough treatment is the result of a series of 5 publications involving animal research or in vitro research, one after the other, the baton taken up by the next team of researchers and moved forward. Well, we know from our audits in Edinburgh, for instance, that the delay between work being submitted for publication and it actually being published is more than 200 days on average. And that means that our fruition, our treatment for motor neuron disease is delayed by 1,000 days just because of the model that we have for disseminating our research work. And taking, even just in Scotland, a new treatment which improved outcome for motor neuron disease by 10%, reducing mortality by 10%, that delay in publication is worth 30 deaths in Scotland, 300 deaths across the UK for one really, really uncommon disease. So when we think about openness and how we can make our data open and our code open, all that sort of thing, let's not just dwell on how we can have everything packaged up and tied up with a bow sometime. Let's also focus on how we can get the pace of publication speeded up. And if that means preprints and preprint servers, as well as, or God forbid, even perhaps instead of publication, let's explore those models. And I think open science is important for another reason as well, and that's because it touches on so much and so many different parts of our research communities. So I now, although I'm old, try and make sure that all of our research data sets are published. And the anxiety that I have as I approach publication of all of our raw data is much, much higher than I used to have for our summary data presented in graphs that no one would ever get to the bottom of, no matter how hard. And it's not because I didn't want to do that before. It's just I make doubly sure that everything is as right as I can make it. And the second bit of it is when you have conversations with colleagues, young and old, about openness and open science, they will bring to the table issues and concerns that they have. The good things in the way that it demonstrates that they're part of a sharing community, a global community of scientists. I can't predict whether my work will inform a breakthrough discovery in someone who works in an institution that's got a full suite of Elsevier subscriptions, or someone working in the global south who can only see stuff in bioarchives. So we're sharing. But then the concerns that people tell stories of how they've been scooped, how they've been working on something and someone's stolen their ideas and taken them away. And that's not a problem with open science, but it reflects and shines a spotlight on some of the problems that we have in our scientific communities, in our research cultures. And so I see open science as part of an almost holy trinity of things that together make up what good science is. Openness in science, research integrity, that's to say the integrity of the research claims that we make, and the research cultures in which we operate. And so it's for these reasons, John, that I'm really delighted that the MRC is recognizing this and working to recognize and celebrate these examples of best practice. So the MRC Open Science Impact Prize aims to celebrate and reward an individual, team, or network of researchers who have developed and implemented open science practices and principles to make research methods, research findings, research outputs more accessible, more transparent, and more reproducible. So we were looking for an individual or a team responsible for developing pioneering approaches and implementing them to innovate, advocate, and to use open science practices to overcome and address some of these challenges. So we were looking for things that went beyond simply publication in open access venues or preprints, but instead demonstrating transformative and innovative ideas, seeking to advance open research practice, in a way being the pathfinders that would show the rest of us how we could perform better, how we could do best. And examples could have included development of open data sharing platforms and standards, development of software or code that improves community uptake and use of research data, open science advocacy initiatives, for example, via outreach and engagement, and many, many others. And as I say, we were delighted by the range of activities that were proposed. There were several outstanding nominations from institutions across the UK, and I think these were truly representative of the great swell of activity there's been in this area in the last 3, 4, 5 years, perhaps longer, and also occurring against the backdrop of a global pandemic, where I would argue that the open practices, which were quite latent at the beginning of the pandemic, as they came to fruition as the pandemic went on, was a major contribution to how quickly biomedicine was able to evolve for the development of vaccines and treatment and the like. So judging this year was undertaken by expert reviewers and we were asked to judge the nominations against the following criteria: the extent and significance of the impact in making research more open, reproducible and transparent. Secondly, how well the nominees approach the development, implementation and sharing of their activities to improve research practices in the wider research community. That's to say that others could pick up on what they were doing. And how well the individuals or teams demonstrated the appropriate skills, knowledge and attributes to drive the impact to fruition. We've got a very difficult job in reviewing the applications and selecting a winner, and we commend all the entries for their broad and outstanding impact. And based on those criteria, the committee have selected the 3 top finalists, and we've got a video now to describe some of the work which they've done to show their impacts, and I'd invite you to watch that now.
For this Impact Award for our work during COVID-19.
Hi, I'm Natalie. I was the liaison to the Centre of the World Health Organization. I communicated scientific evidence generated by the team to WHO and other national and international agencies. It was really important that we understood their priority questions and needs, and that our results were reported back to them as quickly and accurately as possible.
I'm Rich, and I lead the research software engineering group within the Centre. I work with our researchers to develop shared modelling frameworks that allow us to quickly develop models for both the UK and the global responses. By using shared code, we allowed researchers to focus on their science and have trusted, strong, scalable coverage.
I'm Wes. I'm part of the research software engineering team at the Centre. I worked on the software pipeline which collected and curated many different streams of COVID data each day and processed them into one standardised data set that the research team could rely on for their tasks.
I'm Segun. In my role as Relationships and Comms Manager, I developed the communication strategy, ensuring information was shared clearly and accessibly. I coordinated media and supported our research team. I've also managed requests from global stakeholders, including governments, academia, industry, business, and the public, contributing to the mission solution.
If we win this prize, we plan to run national workshops to train other groups in the frameworks used in our response, to encourage early career researchers to develop their own communication activities, and to work with our patient experience research centre to understand how the public engagements.
I'm Paul Winston from the COMET initiative, and together with my committee of colleagues, we are delighted to have been shortlisted for this award. COMET encourages the development and use of core outcome sets, COS. A COS is an agreed set of outcomes that should be measured in all clinical trials in a specific condition. We've created a public searchable database and a process for registering new studies, and we've been able to connect groups working in similar areas with each other. COMET has developed resources to improve how COS are developed, and we highlight organisations endorsing the use of COS. The inclusion of patients' perspectives is one of the agreed minimum standards. Nearly all COS being developed now include patients' views, and the COMET Public Group have been instrumental in providing resources to help achieve this. If we win this award, we would use the funding to identify important gaps, looking at the global burden of disease and registered trials in the most prevalent conditions. We would identify where COS exist and where they are lacking. To enhance COS uptake, we would develop a MOOC explaining how to identify and critically appraise COS. We would promote our alert system so that people can hear when a COS in their area is published or about to start.
It is a pleasure to be talking to you about COMET, which was a project set up in response to COVID-19 and seeking to make data sets from across United Kingdom fair. Never before has a researcher been able to search on millions of records held within a national trusted research environment to understand if data exists to support their research. At this point in time, you can go to the Health Data Research Innovation Gateway and search on data from the population of Scotland. The project was only possible because of the incredible work from such a diverse team, led by myself and Professor Emily Jefferson, Professor Aziz Sheikh, and Professor Susan Hopkins. Patients and the public played a key role in the project, and I think their words are much more powerful than anything I can say.
It's UK-wide, all 4 nations being involved, and it brings together experts from academia, from public health, from science.
I don't think even the researchers really understand how fascinating the work is. And when you look at it from a distance and when it's all on paper, it just really does surprise you.
What could be perceived as a technical project was actually much more about developing new methods of governance that could allow such discovery without compromising on the 5 safe principles. We must not lose what we have all worked so hard to deliver, and the funding from this award can ensure that we deliver policy for a legacy and impact going far into the future.
So the first highly commended entry in the Open Science Impact Prize category is the Co-Connect team, nominated by the University of Nottingham for their impact titled Making COVID-19 Data Fair. So where are you? Thank you again. The second highly commended entry in this category is the MRC Centre for Global Infectious Disease Analysis, team nominated by Imperial College London for their impact titled Enabling Rapid Communication, Dissemination and Uptake of COVID-19 Mathematical Modelling. As they're coming up, I can tell you that when we were sitting on the Commission for Human Medicine trying to work out what to do with COVID, your mathematical modelling was highly, highly helpful. So thank you very much. And for those of you who aren't familiar with degrees of freedom, I'm now delighted to say that the winner of the MRC Open Science Impact Prize 2022 is the COMET initiative, nominated by the University of Liverpool for their impact entitled Enabling Open Science to Improve How Patient Outcomes are Selected and Measured in Clinical Trials. So if you'd like to come up.
That's all right. This is team science, everybody.
No, that's next, I think.
Well done. Well done. Now, Paul, I guess I'll present to you. Oh, so many thanks.
Now, do you want to share a few words with us, Paula, and tell us what you...
Thanks very much. We are absolutely delighted, myself and our fellow committeers here, but there are a few people who couldn't be with us today that I absolutely need to thank. The other members of the COMET management group, Jane Blaseby, Mike Clark, Sean Tunis, and I'd also like to pay tribute to the late Doug Altman, who was one of the founding members of the COMET initiative. We are absolutely delighted with this award. In addition, we've had tremendous support, in particular from one individual who wrote an incredible letter of support for our submission. That's Hal Williams from the University of Nottingham. Also like to thank the MRC for our funding, and of course, the University of Liverpool, where many of us are employed, and we thank them for their support. We are delighted that there will be some funding associated with the award. We're delighted that the MRC, that through this award, recognising the importance of this area, which is about improving the way clinical trials and research is done by improving the outcomes, making them more relevant to patients and other decision makers. So we're delighted with that recognition. Our work is by no means done, and the funding will really help us to keep moving forward. Thank you very much.
Don't let me forget to give you the box, because you squeeze it together. Great. That's the last person holding it. Keep it.
Yeah, you've got to bring it back next year. So thank you very much. And I think echoing what Paula said at the end, Doug would have been slightly pleased at all of this. He didn't always agree with everything that the MRC did, I think it's fair to say, but he would have a little smile on his face that yet we move. So that ends the Open Science Impact Prize, and I'll hand back over to John. Thank you, John.
Thank you, Malcolm. I think it's probably a good thing that not everyone agrees with what the MRC is doing, actually. It probably means we're doing the job right. Anyway, thank you very much indeed, Malcolm. And once again, many congratulations, not only, of course, to our worthy winners, but to those that were highly commended also. Fantastic achievement. So it's now a huge pleasure to hand over to another old colleague of mine, this time from Southampton days. That's Catherine Law, who's Professor of Public Health and Epidemiology at UCL and GOS, a very valued former member of MRC Strategy Board and outgoing chair of our Applied Global Health Research Board and the MRC Prize Committee member. And sad to say that Catherine will be stepping down as she moves on. But Catherine, it's a huge pleasure and an honour to invite you here to come and present the MRC Outstanding Team Impact Prize category.
Thank you very much. I'm Catherine Law. I'm a public health researcher at UCL, Great Ormond Street Institute of Child Health. And it's my great pleasure to introduce the MRC Outstanding Team Impact Prize for 2022. Team science is increasingly recognised as essential for much research, and in particular for the research that addresses the complex so-called wicked problems of today's and likely, sadly, tomorrow's world. Problems such as multimorbidity, pandemics, health inequities, and the consequences of poor nutrition, poor mental health, and poor environments. A team science approach includes and recognises diversity across sectors, across disciplines, backgrounds, career stages, geographies, and many more in enabling impacts. And it's an approach I've been proud to be part of, and I've gained enormously from my many colleagues in many teams. And indeed, As a member of the prize committee, I was also part of a team which oversaw the development, scoring and selection of our entries and winners of this new prize. So let me tell you a bit about what we were looking for. The prize celebrates an inspiring and successful team or network whose collaborative team science approach was critical in making a major impact in medical research. The prize rewards teams who bring together researchers and specialists with diverse scientific backgrounds and skills and different perspectives to address complex and pressing human health and research challenges. To be eligible for the award, teams must have been composed of at least 2 research groups and consist of a diverse range of members from either within the same organisation or across organisations, spanning sectors, disciplines, career stages and geographies. There was no limit on the number of members of the team, though the stage is only so big. But the nomination had to highlight how a collaborative team science approach and the broad diversity of skills and expertise of team members led to the success of the impact. Now, for this award, we were keen to reward teams that included a diversity of career stages and expert members who are critical to enabling research and innovation, but who are not traditionally well recognised. And such team members could include, for example, technicians, data scientists, lab and facility managers, administrative staff, clinical and industrial partners, communication and engagement specialists, and staff filling other roles vital in enabling research and innovation. And as I guess everyone works in teams, and we all know how essential all those unsung heroes and heroines are. The impacts we were looking to reward could include transformative and innovative ideas which are advancing medical research in the UK and internationally. For example, by enabling clinical translation, commercial impact, influencing policy and practice, informing advocacy, and improving research culture. This year, we received several outstanding nominations for teams across a number of institutions in the UK and internationally. And these nominations truly represented the wonderful advances that our research community is making, from improving global health equity to advancing understanding, diagnosis and treatment for conditions such as dementia. It was clear that all those nominated were are truly world-class teams, which are advancing medical research and are leading to key public policy and practice changes. Judging was conducted by a panel of expert reviewers, and we were looking for the extent and significance of the impact, how important a collaborative team science approach, including a diverse range of team members, was in the delivery and success of the impact, and how well the team worked together, and how it fostered an open, inclusive and respectful working culture. And I certainly thought as I read them, it's very difficult actually to write some of these things down on paper. Things you know about your colleagues and what's been successful is so hard to transmit, especially to a bunch of skeptical scientists. However, what we found was people managed it extremely well, and we had a very difficult job in reviewing and selecting a winner of this year's competition, and we commend all entries for their broad and outstanding impacts. It was really humbling, but also inspiring. Based on the criteria, the committee selected the top 3 finalists, and the following video has been brought together by the MRC team, and I invite you to watch it now.
OPMs, or optical compact magnetometers, are small sensors about the size of a Lego brick that use the quantum properties of atoms to measure magnetic fields. We can mount these sensors on the head and measure the fields that are generated naturally by our brains through assemblies of brain neurons.
Because we can track brain function, we can actually see how it breaks down during disease. This can range from childhood diseases all the way up to neurodegenerative things in older age. But one of the most important is probably in epilepsy. During the epilepsy, we track the electrical physical activity that causes the onset of the seizure. But because in OPM-MEG we can also move while being scanned, we can actually scan while someone is having a seizure. This allows us to pinpoint with millimetre accuracy where this is occurring. We can pass this information on to surgeons. The development of OPM-MEG has been a massive team effort. Our partners at QSpin in Colorado, they really pioneered the original commercial OPM. Here at the university, we were able to turn QSpin's amazing sensors into complete systems to measure human brain function. At Circle Magnetics Limited, our scientists and engineers were able to bring all of this together: the sensors, the system, the shielding, additive manufacturing of helmets, and build brain imaging equipment, which is now being spread around the world and used by top labs globally.
The impact for this nomination stems from a project started in 2012 when we tested if menstrual cups could improve girls' health in Kenya. We found cup users had lower lab-confirmed rates of bacterial vaginosis and STIs. Qualitative data explained girls didn't need to pay men with their bodies to buy pads or suffer from using old rags. A team science approach was required with a multidisciplinary team from UK, internationally, and Kenya, including those growing up in the study area. Our team have now completed a UKR-funded trial in 4,000 girls in 96 Kenyan schools with a microbiome sub-study to verify our findings. As we learn, more questions appear on long-term cup use, on lasting effects of school-based interventions, on girls' mental health. As our questions evolve, so does our team, with new members joining to broaden our expertise.
The recovery trial was set up in the very earliest stages of the pandemic to try and identify effective treatments for patients hospitalised with COVID-19. We needed to act very quickly. We needed to enrol a very large number of patients so that we would get reliable evidence. We needed access to potential treatments for COVID-19 that were readily available. And most of all, we needed a team that was able to deliver this at the scale and speed we needed.
The recovery trial found the first answers, the first treatments for COVID in just 10 weeks. It's gone on to find a total of 4 treatments that are effective in reducing the chance of dying for the sickest patients. It's also found another 6 or so treatments which are not effective and therefore have been abandoned.
Thanks to the tens of thousands of COVID patients and their families, and the thousands of NHS staff and other healthcare workers around the world, our funders, the team at Oxford, and all of those who contributed to the recovery trial, we can be really proud of having made a real difference and saved countless lives.
If we win this award, we'll intend to use around half of it to develop a series of training courses for clinicians and researchers so that they can apply the recovery model for future research. Around half will be used for patient and public involvement and engagement activities to help raise awareness of the importance of clinical trials and encourage more people to participate in research.
along with being hit, it's also possible to open the envelope and then read out the wrong name. So I shall avoid doing that. It now gives me great pleasure to announce the 2 highly commended entries first, followed by the winning entry. And the first highly commended entry is the impact of poor menstrual health and hygiene on adolescent schoolgirls and interventions to improve girls' health and equity, nominated by the Liverpool School of Tropical Medicine. Congratulations to all the team, and please could the team representatives come up. Thank you.
Sorry, I'm stage next. Apparently, it's best place to post that.
The second highly commended entry is Next Generation Imaging of Human Brain Function, nominated by the University of Nottingham. So congratulations to all that team. I'm pleased with the representative come up. That's a big stage.
Get up.
Well done, everybody. Well done indeed. Well done, everybody. Right. Many congratulations.
And finally, it's a huge honour, though not a big surprise now, to announce the winner of the 2022 MRC Outstanding Team Impact Prize. It goes to the Recovery Trial, the world's largest study of COVID-19 therapies, nominated by the University of Oxford.
Right. Well, congratulations. Yeah, that's right.
Is someone going to speak?
Yes, I'm pleased nobody stood up to slap me when we won that. There's lots of people I could thank. I asked Anne, our communications director, if I was allowed to thank my mum, and she said no. I could thank all the wonderful team in Oxford. Just a few of us have come up today, but we're privileged to have worked with such wonderful colleagues. Many of us had not worked together before this trial, and it was a great privilege to get to know them. We need to thank all of the people working at all the hospitals around the UK, the fantastic NHS that helped us deliver this, and other hospitals around the world now. But really the only people we really want to thank are the patients. Far too many of them haven't survived to see this, but their willingness to volunteer at such a frightening time in their lives meant a huge amount to us, and has meant that we've been able to give results which we think and hope have had a global impact and will improve things for many, many other people. But thank you very much for the prize.
Thank you very much, and well done to all the entries. John.
Thank you. Yes, indeed. Well done, all of the finalists there, and thank you, Catherine, for presenting. And take this opportunity to thank you for all your contributions to the MRC over the years as you deem it. So thank you very much indeed. Well, it's a huge pleasure for the final components of this afternoon's activities to invite up to the stage Professor Sharon Peacock, who was last year's Millennium Medal winner. Sharon is Executive Chair and Director of the COVID-19 Genomics UK Consortium. She's Professor of Public Health and Microbiology at the University of Cambridge. And before I hand over to Sharon to present the MRC Early Career Impact Prize, if I just cast my mind back to her wonderful address on receiving the Millennium Medal last year and her discussion with Vivienne Perry on the stage, you know, Sharon made abjectly clear the importance of supporting and fostering early career researchers to her and to her group. So it's only fitting that we invite her back now to present the Early Career Impact Prize category for the highly commended entrants and the winners. Sharon.
Well, thank you so much. And it's great to be up here giving prizes. It's actually very humbling for me to listen to the contribution that everyone has made. And so thank you for asking me to do this role. So again, I was one of the expert reviewers of the nominations for this year's MRC Impact Prize. And, you know, following up on what you've just said, John, you know, we have heard from Lisa and Sarah how crucial early career researchers really are to research development. They make the wheels go round. But there's something else. There's an enduring principle about recognizing impacts made by early career researchers, not only for the science that they do themselves, but how they advance the work of others. And that has numerous merits for making science an expansive and supportive environment. So, you know, this reward, this prize rewards those who pioneer advances in improving the wider research environment and culture, which are critical to our systemic reform and improvements in working conditions for everybody. Many of these impacts are actually advances that would would go unrecognized via traditional mechanisms, such as publications. So we do need to find ways to overcome this to reward people. So with that in mind, I want to give you some brief background to the competition. So this MRC Early Career Impact Prize, it recognizes and celebrates individuals or teams of early career researchers who've developed and implemented pioneering approaches in areas that are critical to support future scientific advances. So to be eligible for the prize, the individual or team must have been supported by the MRC or the Medical Research Foundation. And this could be through holding a studentship, a fellowship, a new investigator research grant, being included as a postdoc on a grant, or working at an MRC unit centre or institute. So the impact the judges were looking to reward included, but actually not limited to, really championing open science and research integrity, advocating and advancing equality, diversity and inclusion, developing lab and research sustainability initiatives, and improving public and patient involvement and engagement. So what happened once all the applications were into the MRC? Well, examples of impact nominated included all of those: open science, developing sustainable lab initiatives, advancing equality, diversity and inclusion in research, and improving public health initiatives. So it was actually clear that all those nominated are making key world-class impacts that will have numerous downstream benefits in improving medical research. So judging was based on specific criteria, the extent and significance of the actual or potential impact in improving research culture or their environment, how well the activity has educated, inspired and influenced others in the wider research community, and how the nominees approach the development and implementation of their activity and their role in driving that impact through to fruition. Now, I think it's been a difficult job all round to select winners, but the MRC Prize Committee did have a very difficult job of selecting a winner of this year's competition, and they do commend all entries for their broad and outstanding impacts. But based on the criteria, the committee selected the top 3 finalists, and the following video has been brought together by the MRC team to outline their incredible impacts. Thank you.
I've been nominated for something slightly different for the MRC Impact Award, and that's my work on research culture and open science. This includes bottom-up initiatives like the Reproducibility Journal Club, which allows ECRs to meet together and discuss papers about open science, research culture, or practices. This program has spread to over 20 countries and over 100 different universities. But I've also been nominated for my talent pipeline work. So at the University of Cambridge, I lead a 16-hour lecture course on robust behavioral science practices that empowers students to think about what good science means for them. And lastly, it's also about top-down scientific initiatives. So here at Cambridge, I've been helping launch our policy pilot around rights retention, which allows researchers to make their work open access without having to pay massive amounts of money to publishers. If I win the award, I would use the prize fund to fund a COVID recovery fund for open science community groups. Community groups around this space have been really impacted by the pandemic because people haven't been able to meet in person, and finding new members is really difficult if you're working from your bedrooms and not being able to meet in person. The fund will allow different community groups around open science and research culture across the UK to bid for small pots of money to fund things like catering for their meetups after they've discussed open science and research culture.
Our work has encompassed creating the largest human milk bank in the UK, the Hearts Milk Bank, which is a living experiment. From there, we've been able to assess the impact of dairy milk provision on babies in hospital neonatal units and at home, supporting the establishment of breastfeeding, responding to emergencies, understanding the impact on donors of being able to donate, and how can we make that easier for them, as well as a host of innovation projects aiming to increase cost effectiveness and efficiency of milk banking services. The knowledge created already has been vast, working with over 20 higher education institutions, the NHS, and over 10 innovation-led companies. It's now essential that we can translate that knowledge directly to healthcare professionals and the public as rapidly as possible. By winning this award, we would be able to fund the creation and dissemination of a range of educational modules, upskilling healthcare professionals and giving information directly to the parents and carers.
As you may be aware, there's more genetic diversity in Africa than all other populations. This diversity is key to the treatment of chronic disease in global population. But unfortunately, African populations are underrepresented, which has led to major scientific opportunity, big means to actively champion true representation of Africa in genomics. I am doing major hard work for the inclusion of Africa in genomics, and this advocacy has been featured in several notable media platforms, including the BBC, over 2 highly major genomic programs in Africa, including the Malawi Genome Resource, Uganda Genome Resource, and co-leading the Nigeria 100K Genome Project. I'm using this data to train several African scientists and pioneering the development of African-specific genetic risk scoring for type 2 diabetes and kidney function and other characteristics. Lastly, I'm leveraging smart strategic collaboration and recently established Kidney Gen Africa, which is a set partnership within Africa to assess the impact of genetic a variation on kidney function, with £20,000 of tests and just the most accurate cis-assisted biomarker in 4,000 Uganda. They reliably assess genetic risk prediction of kidney function in Africa. This will cost only £5 per sample.
Right, that was brilliant that we could see that video, wasn't it? Brilliant. And no glitch with the envelope, you'll be pleased to hear. So now we're going to move on to reveal what's on the card. I'm going to start with the highly commended entry. So the highly commended entry for Early Career Impact is Dr. Natalie Schenker, UKRI Future Leader Fellow, Imperial College London, for improving infant mortality and global public health through implementation of a human milk innovation programme and National Milk Bank. Many congratulations. Brilliant. So I'm going to go on now, and the MRC Prize Committee had a really difficult job of reviewing and selecting a single winner of this year's competition and commended all of the entries. And so the decision was actually difficult, but the judges decided to award the prize to two outstanding early career researchers as 2022 winners. So I'd like to announce the first winner of this prize, who is Dr. Segun Fatumo, who will receive a trophy and £20,000 financial award. So would you like to come and say a few words if you feel comfortable to do so?
Okay. Good afternoon, everybody. I feel so honored to be here today. It's a lot of privilege for me to be standing here. First of all, I would like to dedicate this award to my late daughter, our twin daughter, Daniela, who passed away 3 years ago. When I started my group, just about 3 years ago, a few months after Daniela passed, and at the peak of the COVID-19, I never realized that I would be standing here today and raising the trophy in my hand. I want to thank every member of my group. Some of them are here today, some of my postdoc and PhD students that have done the amazing work. I would like to thank the members of the management of the MRC Uganda, particularly Professor Moffat and Puntiano, who nominated me for this award. I would like to thank my family, my wife, my children, who gave me the support to be able to do everything I do. Finally, I would like to thank the MRC for counting me worthy to be nominated, to be selected as the winner of the award. Thank you very much. God bless.
So the second winner of this prize, who will be receiving a trophy and a £20,000 financial award, is Dr. Amy Orben, Programme Leader, Track Scientist, MRC Cognition and Brain Sciences Unit at the University of Cambridge. Would you like to come to the stage? So, would you like to say a few words?
Sure. Normally you can't shut me up, so I was reflecting on the train here actually that about 5 years ago I was interviewing for consultancy jobs during my PhD, because I really didn't want to do any more research, because like many PhD students, the reality of doing research were very, very different to what I'd expected when I got in. And I felt like a lot of it was down to the results that I wasn't producing. Loads of people turned this around for me, and I now lead my own research group at an MRC unit, hugely supported to do the work that I really love doing. And I just want to note a few people. The first is Professor Dorothy Bishop, whom I'm actually visiting in Oxford on the way back, who showed me the world of doing science that isn't for the results, but for doing the best possible science that can be done. And that really brought me back into academia. And a lot of mentors on the way who have reinvigorated my passion for finding out things that help people and progress our knowledge. And lastly, I really want to say a big thank you to the MRC Cognition and Brain Sciences unit, which I joined exactly because they're so supportive of open science practices and really bought into that vision, and also the University of Cambridge. We were told that a lot of these things don't go unrewarded, and it's, well, that normally you don't think you're rewarded for things like this. And so it's great to be able to show ECRs kind of 6 years in the future that now doing this really unrewarded, quite stressful, voluntary work actually leads to rewards, even if they're 5 or 6 years in the future. So thank you very much.
What a fantastic session that was. It was a delight to hand over those prizes, and over to John.
I mean, thank you, Sharon, and I concur. What a terrific afternoon. I just really need to fold up with some big thank yous, but I've realized that before I start, to our last 2 prize winners, don't forget the blue boxes, because they're well padded and they will prevent those lovely glass trophies from being chipped on the way home, but the boxes are over there. So, I mean, what a fantastic afternoon, and wonderful to see our 2 Millennium Medal Prize winners and the Impact Prize competitors, the commended individuals and groups, and those, of course, that won. And just to celebrate the outstanding impacts that our staff and funded researchers make for medical research, for scientific advances, for humanity, and for that most important scientific culture that means that we can make these breakthroughs and deliver them. Following the success of this year, we are delighted to announce that we will be running a competition next year, and nominations open on the 24th of April and will close at the end of June, 30th of June, 2023. So I would encourage everyone here, please, to be a messenger, to be an ambassador for the medal competition, and please spread the word and encourage nominations. It's important, as we wrap up, though, that I thank a few people. I would like to thank all of the ceremony speakers who have contributed so much. I would like once again to thank Lisa Hall and Sarah Tabrisi as our MRC Millennium Medal winners for 2022. I would like to thank all of our MRC Impact Prize winners, and I would also like to thank the runners-up and the many nominations. Several of our speakers have used the term humbling. For those of us involved in the decision-making, it truly was a humbling experience to see the breadth and the depth of science and impact and open science and the effectiveness of our early career research at CADRA and team science that are taking place in the UK. Humbling is a very, very accurate and effective way to describe it. I should thank the prize committee. You'll have gathered they did a huge amount of work shaping and overseeing the prize development in the prizes within our portfolio, and of course that really important work on the judging. I'd like to thank specifically Sarah Trenfield as the MRC Prizes lead, who not only organises all this, but stays calm under fire when the IT fails, you'll have noticed, and delivers. So well done, Sarah. And the engagement team for running and overseeing the competitions and today's event. To Stacey Ann Ashley, who leads MRC Comms, who developed the exceptional communications media that we've seen. Megan Maycock, Ella Butler and the MRC Events Committee for the efficient setting up and running of today's event. Sarah Brygan and the UKRI Creative Service team for their really critical contribution to the visuals. And I would like to thank the venue. They've done everything that they can to ensure that today runs smoothly. And, you know, I mean, catering at large multiple hotels can sometimes be a mixed lot. Actually, you know, the food and the beverages have just been fine. So thank you also to our hosts. Finally, of course, it's most important that I thank all of you for coming, both in the room and those of you who've joined by Zoom. We look forward to seeing you at future events and certainly at next year's prize giving. Please, would you join me in thanking all of those people for making today the success that it unquestionably was?